Hey everybody, John Schumacher here with NewWaveHealthcare.com, and today I'm chatting with Matthew Kelly, who is the co-founder of Patient Talkback, a company that allows patients as well as families to provide real-time feedback on patient satisfaction metrics to hospitals and other healthcare organizations. Matt is also the founding director of a group called Health Innovators in Cambridge, Massachusetts that focuses on bringing people together to collaborate, to talk about a lot of fun, innovative ideas in our healthcare industry. So he's got a lot of hats that he wears today, but he is coming on the show to talk a lot about patient satisfaction, why it's important for hospitals. He's going to share a little bit about Patient Talkback, and those kind of things. So Matt, thanks for coming on the show and sharing some time with us today. Let's just have you start out. Tell us a little bit about you personally, and then we'll jump into your business.
Sure thing. Again, I'm co-founder at Health Innovators, a community-based organization that brings people together in Boston and the Cambridge area to spread the word about healthcare innovation and its direct importance to healthcare organizations. Also, Patient Talkback as well. A little personal background. As I got involved with this during my time in college, I volunteered for a hospital in the Worcester community for over 3 years. And that's really what motivated me to get involved in the startup scene and work also from a nonprofit side in the community, but also creating computer solutions, software solutions to try to help patient satisfaction. What really motivated me to work directly with Patient Talkback was when I was working as a transporter for a while. I was discharging patients, was one of my main roles, and I noticed that the patient's viewpoint of how the quality of care that they were receiving was very different from that of the care providers. And I noticed that this most clearly at the point of discharge, and that really was what really sparked me to get involved in Patient Talkback.
Right. Cool. Thanks. Yeah. So boil it way down for our viewers today, Matt, and share with us, your elevator pitch, if you will, for Patient Talkback.
Sure. Well, I mean, as many of us know, under the Affordable Care Act, recent legislative changes now tie Medicare reimbursement directly to patient satisfaction and patient engagement. So what Patient Talkback does is offer healthcare providers a simple, very low-cost method to monitor, document, and improve patient satisfaction through a cloud-based application that uses smartphones, tablets, Android as the input device, and it installs in a matter of hours to provide actionable information within hours for minimal cost to the healthcare provider.
Perfect. Yeah. So, and that's such an important problem that we have today. Is I just had a patient myself the other day who had gotten home from her hospital stay, and we were in rehab together. I'm a physical therapist, and got a letter from her place, the hospital, about 3 weeks into our rehab. Then it was a patient satisfaction survey, and let's just say she was none too happy about her service. And something like what you guys are providing, which is real-time feedback for that might have, maybe they could have caught that before they got a nasty letter, back from her later. If she would have had, if she could have been able to communicate better earlier on in her rehab or in her recovery, they could have corrected earlier. So do you see that as being one of the major problems that you guys are solving? And talk a little bit about that. Can you paint the picture of the problems you guys are addressing?
Sure. Absolutely. That's exactly what we're trying to solve, John. We're trying to provide feedback solutions that offer care providers actionable feedback, meaning it comes in real time and they can act on it in real time, so that before that patient is discharged, like I alluded to with my story being a transporter back in my college years, before that patient is discharged, we want to make sure that the administration knows, that X patient is having the experience that they are, so they're not going home sort of brooding about their experience, and then 3 weeks later, once their survey finally comes to them, they're not going on a tangent about how horrible their care was. And this is a win-win situation, essentially. It's a win for the patient because they can feel like their needs are actually getting met and they're not afraid to say how they feel. It's a win for the hospital because it really gives them the power, essentially, to act on problems as they're happening in a very low-cost scenario.
Yeah, it's crucial. So were you talked about a little bit about what inspired you to start your company, and it was you were a transporter. You were listening to these patients that were dissatisfied, and what were your feelings around that? Like, what did it move you to? It obviously moved you to a point where you said, I'm going to start a company. We're going to address this problem in our healthcare industry. Talk about some of the feelings you had around that. Like, what inspired you? Was it just those conversations, or was there a bigger inspiration?
Um, it was those conversations, but I'll go a little further to say it moved me in a way that these conversations weren't just occasional. They were almost, I would say, greater than 50% of the patients that I dealt with in discharge um, had a viewpoint, oftentimes very confused about how to deal with their own care management at home post-discharge, or either that are very frustrated at maybe somebody not listening to them or listening to the fact that they didn't understand something correctly, maybe regarding medication, what medications they have to take at what time, in what order after they get home. You know, all these things. There's definitely. I noticed that there was a communication barrier between the caregiver, be the doctor, nurse, nurse care manager, or the patient. Um, and I really wanted to I was really driven to bridge that gap of communication because I didn't want that gap to be there because the more that gaps like that happen in the care management process, and that only means that the hospitals will get a worse and worse reputation.
Right, right, and it's all going to be more transparent too going forward, right? I mean, it's all all the consumers, all the patients are going to have data. This hospital does this well. This hospital does this well. This hospital doesn't do this well. So the hospitals better be concerned about what patients are thinking of them because the market is shifting. It's going to be a more free market model, a more consumer. We're going to have more
Absolutely.
choices in healthcare as consumers. So it's an important thing you're doing. So are you guys
Absolutely.
the only ones on the market addressing this or providing a real-time survey for patients to give to hospitals, or are there other companies in the marketplace already looking at this problem? Can you touch on that?
Sure, sure. So there are some uh, firms in the startup community trying to tackle similar problems as what we are. In the end, it all ties in with patient satisfaction and patient engagement. Um, some companies are doing this, are trying to implement a service where patients' voices are heard um, at the bedside. When they're in the bed, they're inpatient. Um, and some startup companies are trying to get patient feedback post-discharge when they're not an inpatient anymore. But what we really want to do is give the patient the ability to essentially give feedback wherever they are, whether they're an inpatient, whether they're an outpatient, whether they're visiting, whether it's they're doing it from home or they're coming in for an MRI scan and they're going to leave shortly thereafter. We want to give customizable solutions to each care facility and facilities under the roof of the same hospital. For example, an outpatient unit might want different solutions or different prompts or dashboards than might the emergency room or same-day surgery. And those are problems that we're trying to tackle right now in our testing sites in the Worcester community and in the Boston Greater Hospital area is how do we cater to different clients? And it can be as simple as just asking them and having a sit down with them and really understanding their needs. And we're finding out new things about this every day.
Sure. Yeah, yeah. So how are the surveys delivered to the patient? I mean, do they just take it off their smartphone? Is it iPad? Is it some other ways of getting to the content? How do they take the survey?
Sure. We have an easy free installation process by which we simply hang QR codes throughout the walls of the facility and also post them for each individual room as well. So this is a zero-cost installation solution. Now that is compatible with iPhones and tablets or any smart device via QR scanning. But what we also can do for our clients who are already using iPads within their facilities is integrate our software solution as an add-on to their already existing iPads that might already be next to the doors in their ER ward, for example. Because some hospitals will have smart device integration already existing in their wards, but some of them might not. So using a QR code is really how we're starting using this to spread the word about, because it requires no installation cost. So that's really the initial approach we're taking, but we do have capabilities. For example, one of the hospitals that we're working with already uses iPads for each of their rooms in the ER. However, they don't do that for some of their other inpatient units, so have it integrated with their iPads in the ER. However, in other units that they're managing, we just hang QR codes up on the walls of their units.
Very cool. Yeah. So yeah, so that's cool. So basically, they can either take a piece of marketing material and scan their iPhone on it, or their Android phone or whatever, and it pulls up. It allows them to go to the app, take the survey, or you can integrate with an iPad that they already have at their place. Is that
absolutely? And I also want to add too that each QR code is customizable to an individual survey. So that when you scan a code in same-day surgery, the prompted questions that you get can be different to the code that you scan in the ER as per the hospital's desire. So questions that the hospital might want to know specific to the ER might not even be relevant for another ward, and we really want to cater to that.
right? Okay. We talked about it briefly at the beginning, but can you touch on some of the Affordable Care Act influences and all the laws and regulations that are going on that are making it more or less mandatory that these hospitals shape up, they start paying attention to the quality of care and the customer service they're providing for patients? Can you touch on some of the legal ramifications there?
Sure, I can touch on it briefly. Basically, under the Affordable Care Act, reimbursement is tied directly to services offered by Centers for Medicare and Medicaid, being after a Medicare or Medicaid person has received care, they're given a survey via HCAHPS, and this is a way for hospitals to understand how they're servicing patients, and the government ties that directly in to reimbursement. So obviously now, under this act, hospitals now have a financial incentive to improve their care all the time, and how we act as a tool for hospitals to receive better scores and therefore receive higher reimbursement, and by association, we're creating happier patients. So it's a win-win for all. Essentially, is our role in the government legislation side of things.
Cool. Yeah. So, what questions are you guys using on your surveys? Do you mind giving us a couple?
Sure. So right now, for one of our beta sites, we use one question. We'll say, "Did you feel safe?" Another question says, "Do you feel you're getting the attention that you want in a timely manner?" Or were you waiting too long? These are examples of questions that are summoned on the drop-down of each icon, and each icon pertains to a subject, be it admissions, parking, patient experience, and these are all customizable as well. And then after the patient submitted their check boxes on the drop-down, they're given 3 choices to select on each checkbox: satisfied, or partially satisfied, or completely satisfied. And once they do this, they also have the option to write in free text. And this is where we're going to get the goods. We're going to get the some real information about their experience besides rate on a rating scale. This gives the hospital the power to know exactly what's going on. So if a patient's in the ER for 2 hours and they see this code on the side of their room and they're writing a paragraph about their experience, then the hospital will call a bed manager, and the bed manager will know exactly what room to go to because the QR code was hung up in, let's say, room 27. And they'll visit that room and say, I hear you're having an experience, you know, specific to what you explained here. Can you elaborate a little more on that? Is there anything we can do to help? So this is definitely, it really doesn't end with asking a checkbox list of questions. It's only the beginning. It's really, it's just a step in the right direction.
Absolutely. So they can nip it in the butt, right? If a doctor comes in with a bunch of attitude, or a nurse, man, they can really get their QR code out, and boy, those guys are in trouble, right? So I like that.
Absolutely.
That's cool, man. Keep them accountable, and I'm a big stickler for patient or customer service. I think it's a load of crap in a lot of the hospitals, a lot of the facilities. So, good for you guys to give them a voice. Basically allowing them to have a voice in their care that has repercussions, that holds some of these people accountable, and it's not all the hospitals. A lot of these hospitals are understaffed, they're overworked. But it needs to be better than it is, and I think allowing the patient to have some freedom in that equation is a big factor.
And the staff that are on shift might have trouble prioritizing which patient to attend to first. We have integrated real-time SMS text messaging for all our bed care managers. So if something is deemed high priority, they can know in real time, okay, I need to visit bed 27 before I visit bed 26, because if I don't visit bed 27, there's going to be a problem within a minute, as opposed to walking around bed to bed, where maybe half of the people they visit won't be needing their consultancy at that time.
Right. So is this product in beta? Are you guys in pilot studies? Like, where are you guys at with this as far as commercialization?
Sure. In terms of commercialization, our product is ready for healthcare providers right now. We're always developing our product more and more each day to cater to each provider's needs. Because what one provider needs in terms of product development might be very different from what another provider needs. Or private clinic for that matter. So we're always developing our solution, but as it is, we are giving it out to the community for free to really gauge not only how much money can we save you, but how far can we take this? How much value can we add to the community? And that's really our initial motivation in giving this out to healthcare providers for free right now.
How big is the patient satisfaction market? I mean, if someone wanted to start a company around that arena, can you touch on the size of the market?
Absolutely. So the market, from a business standpoint, an economic standpoint, is all hospitals or care providers which service Medicare and Medicaid patients, because those are the patients that are going to directly be tied to reimbursement. However, we don't only want to give the solution to CMS patients. We want to give it to all patients, including CMS patients. Right now, there's 500 plus hospitals in the U.S. And even more doctors and independent practitioners, all of which could benefit from a solution like this. So really, there is a large market, you could say. But I'd say more importantly, there's a need to build market awareness around a solution like this, I think. I don't think there's enough market awareness tied to these type of solutions.
Right. No. So as far as measuring your progress and seeing how you guys are moving forward, I mean, what metrics are you guys using to track your progress? Sure.
Well, we measure some basic metrics. So one metric that we might measure is how many hospitals are we servicing, how many patients are going through those hospital walls and using this application, how can we incentivize patients to use it more. But that's only the beginning. There are other things that we're focused on that aren't always quantifiable. For example, one of our biggest challenges is understanding that each provider is different, and we need to be able to cater to each provider and have regular talks with them to understand that we're adding the functionalities that they need in our feedback solution, know exactly what's going on, as it's happening. And this isn't changing on a day-to-day basis just in terms of healthcare policy. It's changing on a day-to-day basis in terms of, from an operational standpoint of each and every hospital.
Right. Okay. And so when it is time to monetize, you said you guys are giving it away for free at the moment. I mean, can you touch
Yep.
on the business model you guys are going to use to scale and grow your guys' vision?
Absolutely. So when focusing on costing models, you have to understand how much savings, or at least create a hypothesis for how much you're going to save the hospital in terms of reimbursement. And obviously, you don't want to charge that number precisely. You want to be adding a lot of value to the community and motivate people to keep using this, which is going to create a win-win for all. So, as you said, we are giving it away out free right now. In terms of monetization, we want to make sure that if we're giving to a smaller health facility, that they can have some of our basic functionalities for free. If it's a larger health facility, we're going based on the number of patients that can go. So it's not only how many beds do you have, it's how many patients are coming in and out of your medical facilities on an average basis, and that's really how a cost structure will be built when that time comes around. However, we do always want a base free solution for everybody to have. For example, when I say costing, I really mean costing for more advanced capabilities in our solution via analytics, reporting capabilities, real-time device integration with devices that care managers are using. These capabilities will end up costing the more and more a provider is using it. However, we still want to have a base model solution that private care centers, small care facilities, and not-for-profit facilities can have for free as our way to give back to the community. So there always will be a free version available.
Okay. And then you said for the pay version, can you boil that down a little bit for us? Like, is it going to be a per bed? Is it going to be a subscription model?
Sure.
Do you care to touch on that, or?
Sure, I can touch on that briefly. So it will be licensed to use our service, and that will be based mostly upon, like I said, the amount of patients they see on average. Of course, once a care facility gets to a point, it's so large, they might be seeing 5,000 patients on average per month, per year. But once you get into the 10,000s, we want to have a maxima, obviously, with our pricing structure. But like I said, it's going to stay to how many patients are you seeing, because that's how many patients come in and out is really how you judge how many people are going to use the solution.
Sure, sure. So what was the biggest challenge that you and your co-founders faced while you were creating this, getting the idea, getting traction, and moving in the right direction?
The biggest challenge was understanding that every care provider is different. We can't have we can't program a solution. We can try, but we're always going to need to make changes and have regular sit-downs with different hospital departments to truly understand their needs, to keep up with changing conditions in their own health facility, and making sure that it's specific to their environment in which they work, and ensure that they won't be dissatisfied with it. And
Right.
after the solution is implemented, the challenge isn't over. We're always having additional meetings and adding additional functionalities to our feedback solution, so we know exactly what's going on and that we're catering to that as it's happening. So it puts a lot of responsibility on myself and my team to have regular follow-ups and understand, okay, how can we improve your satisfaction numbers, and what do you need us to do from an IT development perspective to make that happen?
Right. Okay. All right, Matt. Well, this is the last question of the interview,
Sure,
and
absolutely.
it's a bit of a doozy, so take your time here.
Okay.
If the Affordable Care Act put in new legislation for your company, how would you want it to read?
That's a good question. So if the Affordable Care Act were to add a new legislation, meaning additional to what's already existing,
Yes.
I would want it to read that mandating care facilities to have the ability to gauge how their patients are feeling on an individual basis and also on a real-time basis. So this means that on any given day, an administrator must have the ability to open a browser at any given time and have the power to understand each individual visitor or patient, understand their feelings about how their care is, and not their revised opinions either, because I know that sometimes when asking patients to take a survey while they're already inpatient, somebody might hand them the survey while they're sitting right in front of them, and they make the patient feel like they have to answer, generously, because they might assume that a doctor will look at it shortly thereafter. Well, I would want it to be mandated that patient privacy would be protected, and that patients could feel comfortable in submitting their actual upfront and honest feelings about their care, and that administrators would be able to access this in real time. Absolutely. So this is our approach to ensuring every patient is satisfied from the time they're admitted to the moment they're discharged.
Absolutely. That's a great goal, and you guys are heading in the right direction. So, Matt, it's been a pleasure to have you on the show today to share talk about your company and about an important issue that people, you're right, need to be more aware of, and that is that patient satisfaction is important. Things are becoming more transparent in our industry, in our healthcare industry, so customers need to be aware, and there's going to be this data available for them to pick and choose where they want to get their healthcare done, and I think it's a neat mission. So let's just wrap things up by having you share a little bit about where our viewers and listeners can find out more about you, and then we'll say goodbye.
Sure. Great. So feel free to check us out. Our organization where we hold monthly meetings is called Health Innovators. You can check us out at www.healthinno.org. We hold monthly meetings every month here in Cambridge, Boston. Our next event is at the IBM Innovation Center about funding healthcare innovation. How do we fund it, and approaches to doing so. So that's on April 16th. And you can find out more about Patient Talkback at www.patienttalkback.com. And probably find my name on the About Us page associated with that. So.
Yep, it's on there. So thanks, Matt. Thanks for coming on. All right, everybody. I hope you enjoyed that discussion today. If you're listening to this on iTunes, go over to newwavehealthcare.com/Matt Kelly to view the video recording of this discussion. And you'll also find all of Matt's information linked up there on the show notes page. So head on over to newwavehealthcare.com/Matt Kelly. If you are watching this on the newwavehealthcare.com website, check us out on iTunes. There is a banner, a clickable banner on the sidebar of the website where it says Hear Us on iTunes. Go ahead and click on that banner, subscribe to our podcast, give us an honest rating and review so that you can listen to these wonderful, inspiring, and informative interviews on the go. All right, everybody, I'll see you next time.